My name is Dr. Alex Quas. I'm one of the interactive associates, and it's my great honor to be with Brigitte Adams, who is one of the keynote speakers at this year's ASRM meeting, and she spoke about oocyte freezing, a patient's perspective. Welcome.
Thank you very much.
So tell us a little bit about your lecture.
So my lecture this morning was, I was an egg freezer, and I started a blog about egg freezing, and my eggs didn't work, and it was a lecture on coming full circle, doing the part A of retrieving, freezing your eggs, and then coming back and using them later. I was invited by the ASRM to bring a patient's perspective to this journey that, is one that is often overlooked, but is really critical to, having a good clinical practice.
Mm-hmm. And so what is the essence of your advice to patients?
I'd like to switch that question around and say what's the advice to physicians and REIs. Really, there's not a lot of information and data for patients. The women that are coming in to freeze their eggs are about 85% single, by and large single, well-educated women. And really there's sort of a lack of data, a lack of transparency and consistency in terms of, ideal egg count, ideal number of cycles. So really just turning it around and talking to doctors and, giving women more personalized data points and clear navigation paths through the egg freezing process.
Yeah, that's great. And so would you say it's important to have the right expectations in this process and to be as well informed as possible, or?
I think that's key. I mean, when you look at egg freezing, there is a lot of press about it being an insurance policy. You freeze, you're done, you're set, and my story in particular, it didn't work for me.
Yeah.
And it's as more women come back to use their eggs, because there haven't been that many women to come back, it's not going to work for everyone. So I think having really doctors relaying that, it is something that can help you have a future child, but it is not a guarantee. And I think that, again, gets lost in the message sometime. It gets lost in the initial assessment and gets lost after the retrieval.
That's really valuable to hear that patient perspective for us. And you told me that there was a happy ending to the story.
Yes, a very happy ending in the form of a 17-month-old daughter named Georgie, and I conceived her via an egg donor.
Wonderful.
So my plan B did not work, but plan C did, and I think that, going into egg freezing, hopefully it works for the women who freeze and want to come back and have a child with those eggs, but if they don't, there are many different options to have a child.
That's wonderful. Well, we really welcome your transparency about this, because I think it's wonderful to have that patient perspective, and you've really, I think, enriched all of us with your advice. Thank you.
Great, thanks very much. Bye.
Thank you very much.